Good evening, everyone. Welcome to tonight's webinar entitled State of California Requirements, Cal OSHA, which, as most of you know, is the Division of Occupational Safety and Health. This webinar is hosted by the City of Los Angeles Department of Cannabis Regulation. My name is Frank Louie with the Cal Asian Chamber of Commerce, and I will be the moderator for tonight's event. Before we get started, let's take a moment to review some housekeeping rules. Please note that this webinar is being recorded and can be viewed after the editing process on DCR's website. You will be muted with cameras off for the duration of the webinar. This means that your camera and audio functions will not be available to you during the session. However, you will be able to see and hear all the panelists. There is an open chat box where you can interact with one another for networking or comment on the information. Please use caution when sharing personal information in the public forum and keep your questions focused on tonight's topic. And please ask questions about tonight's subject matter in the Q&A box. We are gathering and responding to your questions throughout the presentation, and we'll have a Q&A session where you will get a response in the last 10 to 15 minutes of tonight's event. You are also encouraged to utilize the Q&A box at the bottom pane of your Zoom screen. If you use the Q&A box, everyone will be able to see the questions when they are answered. And finally, please note that the content presented tonight was not created by the Department of Cannabis Regulation or the City of Los Angeles and is for informational purposes only. This information is subject to change and does not replace or supersede the Los Angeles Municipal Code nor constitute legal advice. If you have any specific questions outside of tonight's topic, please call 213-978-0738 during business hours to speak to a DCR representative. Now let's transition to the presentation tonight. I'd like to introduce you to our speaker tonight from Cal OSHA, Zora Ali. Zora Ali is currently a senior safety engineer for the Cal OSHA Consultation Services branch. Ms. Ali has more than 20 years of experience with Cal OSHA. She worked more than 14 years in Cal OSHA enforcement as an inspector, in which she conducted numerous complaint and accident investigations and many programmed inspections. She also held the position of district manager for 2 Cal OSHA enforcement offices for more than 3 years. Without further ado, I'd like to ask Zora to join me on screen. Hello, Zora.
Hi.
Welcome.
Thank you.
Yeah, and feel free to share your screen and begin your presentation tonight. Thank you very much.
Okay, thank you. I'm going to share it. Let's see. So, can you see that okay?
Yeah, I do.
Okay.
There you go.
Let's see. Okay. So, good evening, everyone. I'm going to be talking about the Cal OSHA regulations, basically in the cannabis industry, which covers many different parts of that industry. So just in terms of what I'll be covering, I'll be talking about what the purpose of Cal OSHA is, because as I understand, there are some people that are just starting up businesses here. So I'll tell you what we do and why we're here. What are triggers for an enforcement inspection? Because everyone thinks about Cal OSHA enforcement when they think of Cal OSHA, but I am consultation. The types of programs, and that's written programs that you should have in place if you are starting a business. And also the types of activities that are involved in the cannabis industry, the types of hazards that you might find in the cannabis industry, and the jobs in the cannabis industry and the related hazards. So the types of hazards are more general. I'm going to talk about specifics for jobs in the cannabis industry. I will also talk about the 30-hour general industry training requirement that you're required to have if you have a license, if you're going to get a license. And then lastly, I will talk about how Cal OSHA can assist employers, can assist you if you want us to help you at your business. So in terms of the purpose of a Cal OSHA is there to ensure that workers are safe and healthy at work. And Cal OSHA will only look at the employer-employee relationship. So there have to be employees present for us, for Cal OSHA, whether it's enforcement or consultation. You can find all of the standards on our website, and those are considered, they're called the Title 8 of the California Code of Regulations. Those are all of our regulations. We cover safety and industrial hygiene standards mainly. That's the focus. So safety, of course, everyone knows safety. Industrial hygiene is my background, and that's more in terms, we're looking at health related violations. Cal OSHA versus federal OSHA. Cal OSHA regulations are supposed to be as stringent or more stringent than federal OSHA regulations. So you will find that we are more stringent in some cases, sometimes the same. And Cal OSHA does not have jurisdiction over federal facilities either. So it's either going to be Cal OSHA or federal OSHA, but for most private industries, it will be Cal OSHA that will have jurisdiction. In terms of an enforcement inspections, everybody knows about Cal OSHA enforcement in our district offices, and the first thing that could trigger an enforcement inspection is a complaint, and they can be filed by anyone. They can be anonymous, but they're going to still be reviewed by the manager to determine whether they're going to send an inspector out to look into that complaint. If there is a reportable accident, then the local office, district office will investigate. And program inspections can be in any of these fields that are listed, anywhere from construction, agriculture. Agriculture could affect some of the cultivation processes with the cannabis industry. And there's also the high hazard program. And there's a high hazard unit that only does program inspections, but they will focus on industries or facilities, businesses that have experienced modification rates of 125% or greater. So that's what qualifies you as a high hazard industry, or, well, employer in this case. As an employer, you need to determine which programs are applicable to your business. There are a lot of programs out there. It doesn't mean they all apply to you, but I'll briefly cover the first three because they're fairly important and they are going to apply to a lot of you. The Title 8 section, which of the regulation numbers are in parentheses next to each program, so that if you want to take a closer look at these programs, you can go to our website and look these up and see what's required. The first one is the Injury and Illness Prevention Program, and that's been required since July 1st of 1991. It has to be written and specific to your company, implemented, basically you have to be doing it, and effective. And if you even have one employee, even one part-time employee, you must have this program in place. And note that it has to be written, and implemented means you're actually you're doing what you say you will do in the written program, and it must be effective. And just so you know how important this one is, this is one of the most cited regulations. Even though it's been required since 1991, it's always in the top 2. So this, if you're going to start a business, this is the first thing you should put in place, the Injury and Illness Prevention Program. And in terms of, I'm talking a little bit more about this because it's so important. And in terms of the elements of an Injury and Illness Prevention Program, there are 9 that are required. And again, these have to be in writing. So the first is who is in charge of the program. You have to note that who has the authority over this program, who's going to make sure it's actually being done. Methods of compliance, basically it will be your disciplinary procedures. For instance, if employees are not following your safety rules, how are you, what are you going to do if they're not followed? Do you have, you have to have that in writing, and your employees need to know what those are. Communication, how are you going to communicate with employees? For instance, you could do safety meetings. It's totally up to you how you do it. And hazard assessment, who and how often. That basically is periodic inspections of your facilities. If you find things that need to be corrected, you have to address the correction in terms of who will correct them and when they will be done. Now, if you have an accident, you should have a procedure to investigate that accident. Who's going to do that? What kinds do you have forms in place that you need to fill out? It's up to you, but you do have to have a procedure in place. Training has to be addressed for all employees. New employees are definitely going to have training. If you have new processes, new equipment, you're going to want to train on those. The newest element is the employee access to the IIPP, and that's been in effect since July of 2020. So if any of you have IIPPs in place that are older than that, you might want to update that and put this element in there, because it would actually be a violation if you don't have this element. And you want to document periodic inspections and training. So definitely have your documentation in place. There are many resources out there for an IIPP. If you take a look at our publications page, there's a lot of information on the IIPP and how to create one. Our resources contain guides to developing an IIPP. There's a model IIPP in English and Spanish, and they're fillable. So if you don't have one yet, you can take a look at this one to set one up. And I can guarantee you this will be a program that if you have Cal OSHA enforcement or consultation on your site, they're going to ask to see this. State Fund also has a very nice IIPP builder, which is we have a link to on our website, which you can also use if you like. So take a look at those if you don't have one in place. And of course, everyone knows about COVID-19. We still have that regulation in place since November 30th of 2020. And all employers, everybody has to establish, implement, and maintain an effective written COVID-19 prevention program. This sounds a lot like the IIPP. Again, establish, implement, effective, written. And it can actually be part of your IIPP or maintained in a separate document. That's completely up to you. Whatever is more convenient for you, you can do it either way. But we are actually now on our third version of this regulation as well. So we have fact sheets on the ETS, we call Emergency Temporary Standard. And the third revision, these fact sheets talk about the third revision, saying what is still in place and what has changed, because there have been some changes since that came into place in November of 2020. And we also have some other resources on the model program that you can also, it's also fillable in English and Spanish and this is updated and it's current with the third readoption. So if you have anything, the third readoption went in place in June of this year. So if you have a COVID prevention program and it's older than that, you might want to take a look at this to update it. So if, like I said, you can just use these and fill them in. They're very easy to do, and you can tailor them to your workplace. In terms of COVID-19 in 2023, January 1st of 2023, we're expecting the COVID-19 standard to change again. It will not be an emergency standard anymore. And I have the links here for you to take a look at if you like. The proposed text is there in terms of how it will read. And I don't know if that's going to change any further because the standards board is supposed to vote on this in December. So you might want to keep track of that in that first link for the rulemaking. It will tell you what's going on, when the next meeting is, when they might vote on it. So this will definitely affect your businesses again when this changes again. And we have a web page on COVID-19 information. There's a lot of information, including FAQs. The FAQs generally come from employers and questions that we get in our offices. The last section shows webinars on COVID-19. We don't have anything scheduled yet, but just keep watching this section. And if we do, they will be listed here, and they're always free to attend. You can register for free. The next program I wanted to talk about that's really important, especially in the cannabis industry, is the Hazard Communication Program. And again, it reads similarly to the last two: develop, implement, and maintain a written program. And without saying it has to be effective as well. And if you're working with any hazardous substances, including chemicals. So this is the thing, it's part of, when we went back to the IIPP, part of evaluating your workplace for hazards. And that's what you need to be doing to determine what programs you might need. And the elements of a hazard communication program, you do need to have an inventory of the chemicals that you're using. You also have to have the safety data sheet for the chemicals that you're using. Sometimes people don't have them. If you're getting them from your chemicals from a manufacturer, they should be providing the safety data sheet with them. all chemicals, containers with chemicals have to have labels on them. Even if you have a dilution of a chemical, it should still be labeled as what's in it. Employees have to be trained on the chemicals they're using, including the personal protective equipment that they need to use when they're working with these chemicals. That's very important, that employees know the hazards of what they're working with, not just equipment, but also chemicals. And again, our website has many resources for the hazard communication program. There's a very nice fact sheet. There's a guide to the hazard communication program as well. It's very detailed and explains the program. And again, we have a model program that you can use to tailor to your own work site. So you should always take a look at these model programs, and some things may apply to you, some things may not. And in terms of the activities in the cannabis industry, there are several that you want to consider in terms of looking at health and safety within the industry. So they would be cultivation, distribution, manufacturing, laboratory testing, and retail. And we'll talk about those in a little more detail. Safety and health hazards in general within the industry, there are many to think about. Not all of these may apply depending on your operation. That's as part of your IIPP, you do have to do, as we were saying, a hazard assessment, which is part of your inspections as well. So you should be assessing your facility and business to determine if you have any of these hazards. There are links in these sections to all of these types, like electrical hazards. If you click on the link, it will take you to all of our sections on electrical hazards that you can take if you want to take a closer look. And that's on our page too, our page specifically on cannabis that I'll show you later. But if you see in here, we have the injury and illness prevention program that's going to apply to everybody. We also have heat illness prevention that won't necessarily apply to everybody, but if you're a cultivator, if you're out in the field, in an agricultural field, it will apply to you. All repetitive motion injuries, slips, trips, falls, and use of ladders. We see that a lot in many industries. And of course, electrical hazards will probably apply to everybody. So you want to take a look at these lists and see, like I said, what applies to you and what does not apply to you. Not everything will. So in terms of the jobs and their related hazards that you'll find within the cannabis industry, the first one would be a cultivator. And again, their duties are planting and watering, nutrient mixing, applying pesticides, possibly cleaning and harvesting. So the hazards that you want to look at are things like mold, sensitizers and allergens, pesticides that your employees could be exposed to, ergonomic issues with repetitive motions, walking and working surfaces, are surfaces uneven, slippery, wet. Lighting hazards, if you're working at night, you have to make sure the illumination is at the levels that are required. And we do have actually requirements for illumination levels in agricultural fields. Chemical exposures. Again, you're looking at the hazard communication program for things like chemical exposures, carbon dioxide and carbon monoxide as well. Trimmers, trimming, packaging, shipping, and data entry and cleaning are their duties, but the types of hazards they could be exposed to are mold, sensitizers, and allergens. Again, carbon monoxide and carbon dioxide, pesticides, ergonomic issues like repetitive motion, occupational injuries, if they're cutting, using any kind of cutting, even scissors, knives, we see injuries with those all the time. Chemical exposures, again, machinery, what kinds of machinery they're using. Is it well guarded? Or are they trained on that machinery? That's the other thing. You want to make sure they're trained on everything that they're doing. An extraction technician, their duties are basically extracting the marijuana concentrates. And the potential hazards, again, would be machinery, indoor air quality, allergens, noise depending on the equipment, ergonomic issues, again, repetitive motion injuries, chemical exposures, use of explosive or flammable chemicals. And in terms of the noise issue, there are certain levels that you cannot exceed, certain noise levels that you cannot exceed. So if you suspect you might be exceeding those, that's something you want to monitor. And you can control noise levels in some cases, depending on your facility and what you're doing. There are people that actually cook with marijuana. So in terms of cooking, baking, this would be more like a bakery type of exposure. So the occupational injuries you might see there would be burns, chemicals, the use of chemicals for cleaning, for instance, and noise issues. Again, as I said earlier, if something is very noisy, a piece of equipment, you want to make sure that the noise levels are not being exceeded, and there are ways to monitor that. Bud tender duties, sale representatives who sells marijuana and marijuana products to customers. The potential hazards, again, sensitizers and allergens, the ergonomics, and workplace violence. And this is the first time we're seeing workplace violence. And I just want to note on workplace violence that there is a standard now for workplace violence that is specific to the healthcare industry. But the standards board is actually working on one for general industry, which would cover, for instance, retail stores and anything that's not in healthcare. And if you want to see, there will be updates on the standards board website. I believe the last update that they have on there was May of this year. So that one might possibly be moving, and you can always see if there are any meetings and board meetings, you can always sit in on those as well. Usually they're open to the public. So you definitely want to take a look at that, because this is definitely an issue within this industry, workplace violence. The laboratory technician, they're basically operating laboratory equipment. And the only thing they might be dealing with would be solvents or chemicals, and then ergonomic issues, depending on what they're doing in terms of repetitive motion injuries. The cultivator, the owner operator. So basically you're running the business and you might be overseeing and involved in other functions as well. So you could be exposed to many things, including sensitizers, allergens, mold, carbon dioxide, carbon monoxide, the pesticides, high pressure machinery, noise, chemicals, and again, workplace violence. The one thing to think about as the owner, if you are the owner, is that you need to be aware of your employees' duties. They might not be working at one location. If they're working at other locations, be aware of the hazards that they might be exposed to at that other location to keep them safe. So if you're sending someone from a store to a field, the field has different hazards than you might see in a retail store. So you want to be aware of those and look at, again, we're talking about the hazard assessment again, see what's going on in those fields so you don't expose your employees to any hazards if they're moving around from one place to another. Administrative, of course, is the day-to-day operations. It could include financial roles, human resources, retail store. Again, in these cases, we're looking at ergonomic issues or repetitive motion, again, workplace violence as well. Transportation of product or money between growing and retail facilities, occupational injuries. Also, again, workplace violence is another one. You might have maintenance people that are non-contracted, so their duties would be maintaining your facilities and equipment, your HVAC systems, and these are just some of the potential hazards, but not all. Elevated heights and electrical hazards are some of them, but you want to think of other all sorts of things in terms of maintenance, because maintenance usually deals with many different things. And just as a summary with biological hazards, you're mainly looking at mold, which some of the symptoms you might see would be nasal congestion, throat irritation, coughing, wheezing. Sensitizers that are dermal, so your skin sensitizers, so contact dermatitis and allergic reactions on your skin, or respiratory sensitizers, where you would see similarly itchy, runny, congested nose, sneezing, coughing, wheezing. Now, if any of your employees are experiencing any of these types of symptoms, you should be taking a look at what might be causing these symptoms. Also look at the personal protective equipment that they're wearing, because oops, I think I went to the wrong page. Yeah. So look at the personal protective equipment that they're wearing. With mold, you want to look at things like water intrusion and water buildup at your facility. You should also have good engineering controls, such as a local exhaust ventilation system that's working well, as we talked about earlier, the HVAC system. And chemical hazards, again, we're talking about the hazard communication program that would list these chemicals. You want to train employees on the chemicals and the hazards of the chemicals, make sure they're using appropriate personal protective equipment. And a personal protective equipment would be things like the appropriate gloves. Do they need eye protection, things like that. Look also at engineering controls such as ventilation, where you're talking about looking at carbon dioxide, carbon monoxide, volatile organic compounds, and consider substitution as well, because substitution is basically where you use a less hazardous chemical instead of a more hazardous one for the same task, if you're able to do that. If you're using corrosive chemicals, you may need to have an eye wash station in place. Again, that is part of your hazard assessment that you should be doing before you have employees working with all of these things. And the physical hazards, again, there are many of these, and they might not all apply to your facility. So again, take a look at what's going on. These are just something to give you something to think about when you're looking at where your employees are working or what type of equipment they are operating or using. So things like compressed gas, for instance, like if you have air tanks or any compressed gas cylinders. Again, ergonomics, are there repetitive motions? Walking and working surfaces, again, are they uneven or slippery? Working at heights, are you using ladders? Employees need to be trained in ladder safety as well. Many hazards with electrical that you might want to take a look at those standards to see what applies. Again, with noise, make sure that the noise levels are not too high. If you're using a forklift, then there's certain requirements in place for those, such as the operators need to be certified. You should be doing daily checks on those forklifts. Lighting, again, are you in the field at night? Are the requirements there for lighting levels, machines, guarding issues? You want to make sure they're guarded at their points of operation, where the work is being done. Confined spaces, are any of your employees entering any confined spaces? There are specific regulations on confined spaces that you need to be aware of and make sure that you're complying with as well. And this is our page on the cannabis industry. It's has all the information that I've been talking about, as well as other resources. You might want to take a look. It's not just, if you scroll down to the bottom of this page, there are many, many other resources that we have on our site that you can use to reference. The other thing that comes up is the 30-hour general industry training requirement. We get questions about this quite a lot. And this is a requirement for a state license to conduct commercial cannabis activity. And OSHA does not enforce the California Business Professions Code. In this case, one supervisor and one employee have to successfully complete a 30-hour OSHA 30-hour general industry outreach training course, and authorized by an OSHA Training Institute Education Center. And if you go to that general website that I mentioned, it has links to find a trainer for this course. Just make sure that it's a general industry course and not a construction course, because some people have taken these 30-hour construction courses, but they will not meet that requirement. So you want to make sure it's the general industry course. And when you're signing up, you can always explain why you're doing that, and just tell them it's because you're want to get a license to conduct commercial cannabis activity. In terms of our consultation services, I'm part of the consultation service. I used to be enforcement, but I would strongly encourage you to ask for a consultation at your work site. We don't just come to your work site. We have to be invited to the facility by you. And we try to work proactively with all the employers. There are no citations or penalties. It's a completely free service as well. We don't share information with enforcement at all. We do develop publications, as I was showing earlier. There is a publications page, and we answer questions by telephone. So if you have further questions after this presentation, you can always call us at any of the 7 offices that we have, depending on your region. And just as the difference between enforcement and the consultation branches of OSHA. So enforcement, again, There's citations usually with monetary penalties. It's a very reactive approach to safety and health. It's a reaction to a complaint or an accident. There is potential litigation because they can be appealed, they can go to hearings. With consultation, again, there are no citations or penalties. It's proactive and hopefully will reduce your workers' compensation costs and lost work days. And you can invite your workers' comp carrier to come. We've had some consultations where people will bring their safety person or their workers' comp person with them when we do the consultation, which is completely fine. You can do that. And these are our consultation offices that you can call at any time during a work day. And if you get a voicemail, leave a message because we do check them. And these offices are listed on our website as well. But if you're interested in a consultation, you can contact the office that's within your region. But again, as I was saying earlier, you want to make sure that you do have employees before we actually come to an onsite, because part of what we do is we do interview employees as well. It's important that we talk to employees when we do a consultation for you. Okay, I think I went kind of fast with that. Anyway, I don't know if there are any questions.
Hello, Zora. Sorry about that.
That's okay.
Yeah, great information. There's a lot there, though. There's a lot to unpack.
I know.
So yes, we have several questions that have come in, but good information. I mean, just summarize again. I mean, Cal OSHA, like a lot of the state departments, there's so many that you have to, be up to speed on and be familiar with. But clarify again the industry verticals. I mean, whether it's cultivation, distribution, I mean, all the verticals are required to engage, follow, and have a plan for these Cal OSHA requirements, right?
Right. I mean, the injury and illness prevention program, I always tell people do that first. That's probably your number one program that you should have in place first if you're starting.
Yeah. So, but again, they're all a little different, obviously, but they all are required. There's no one that's excluded from those, right?
Exactly. Yes.
Okay.
I mean, Cal OSHA looks at the employer-employee relationship. As soon as you have an employee, these apply.
Right. Okay, good. So let's jump into some of these questions. We've had some questions that were submitted, and I want to just kind of dialogue these with you. Yeah. So, given the requirements to comply and be prepared and be an effective business in the city of LA, given the Cal OSHA requirements, can Cal OSHA actually shut down your business?
This can happen in some circumstances, but it's not typical. What's more likely to happen is that Cal OSHA can issue what we call an OPU, which is an order prohibiting use. And that can actually shut down a process or a piece of equipment that we call an imminent hazard. And an imminent hazard means that hazard can cause death or serious physical harm immediately or before it can be eliminated through our normal enforcement procedures. So maybe not shutting down a whole business, but sometimes shutting down a vital piece of equipment could, in effect, stall that business.
Mm-hmm. Yeah, well, I mean, if there's equipment and you have to shut it down, it would literally maybe stop your business, right? Because especially depending on which, if it's manufacturing or cultivation, it may literally put you out of operation for the period of time, right?
Right. And usually when an OPU is issued, there's a tag that is tied to that piece of equipment a piece of equipment usually, and you cannot work over that tag either. It's considered a misdemeanor if you do. Okay,
great. And I did see there was someone that submitted a question about putting the presentation in the chat, but this this is being recorded, and there are some resource guides that will be uploaded to the DCR platform as well, so people have access to a lot of this information. The next question that has come in: what are the top 5 violations that have been issued by Cal OSHA?
Well, I can tell you for the last 5 years, because actually I did a presentation on this recently, from 2016 to 2021. The top 5 have been no injury and illness prevention program. And as I said earlier, that's always in the top 5, usually the top 2, considering it's been a requirement since 1991. No heat illness prevention plan. Now, for those people in the field, in an agricultural setting, you're going to have this in place. And that's usually in the top 5 for agriculture. Not reporting an accident, that's also in the top 5. And that's really important, that if you have an accident that's reportable, you need to report it to a district office, because that is a $5,000 fine if you don't.
Wow.
And no hazard communication program, which I talked about earlier. If you have chemicals or working with anything hazardous, you need to have this program in place in writing. And then the last one is no eye wash. Eye wash is probably a little more connected to the hazard communication program. If you have corrosive chemicals, you're probably going to need to have an eye wash available for your employees. So those are the top 5 in the lap from 2016 to 2021.
Okay. And I don't know if this was top of mind on in your clarification in some of the slides, but you say not reporting an accident. I mean, how do you report an accident? I mean, what is the process? Because that, at what level of accident, right? I think there's always something that happens every day, right?
Right. I mean, it has to be a serious injury. And actually, if you look on our website and it just defines what a serious injury is. And that has to be reported within 8 hours to your local enforcement office. So, and there is, on our website as well, talks about how you do that, how you determine which office it is. And actually, sometimes people call consultation to ask us, which is fine. You can call us to ask us which office and what to do. But you definitely want to make sure you meet that 8-hour time period if it's reportable.
Okay. So the website's clear on how to report an accident.
Yes.
Okay. Another question that's come in: how do I stay on top of what is required from Cal OSHA in terms of regulations that I must follow?
Well, you can start with our website, which is www.dir.ca.gov, and there's a lot of information. And if you scroll down, it tells you what's new, what's up to date. It tries to keep everybody up to date. And publications are there that pertain to your industry. This is also why we have a free Cal OSHA consultation service. We can help you with that too. And we can help you with any questions that you have. And again, probably the most recent, the one upcoming is going to be COVID-19, which is going to change again in January. So that's something you want to be watching for on the website.
And that's COVID-19 protocols as a business operator.
Well, the regulation is going to change itself. So that's going to affect every business. So, yes.
Yeah. I remember all those, just protocols and communication with employees and staff, and in the early days, masks and hand washing and all that. So all those things are going to change. So you have to stay on top of those, right?
Right. And that will be on, I'm sure they'll note it on our website, but definitely in one of my slides, I showed where you can see what's going on with that standard that's coming up. They're supposed to vote on the regulation next month.
Okay. And then, given all the, what I think of as sometimes kind of complex requirements in trying to keep all your employees and staff safe, do I have to hire someone to manage the health and safety aspects of my operation? I mean, I feel like, as a business operator, I feel like there's a sense that I need to hire someone that knows these topics well.
Well, we don't advise on hiring and whether you should hire, but so that should be the employer's decision. But as discussed for the IPP that you have in place, someone has to be responsible for it. So you can decide who that's going to be. And, as I said, we don't like to advise on hiring people, or whether you should or shouldn't, that's up to you. Some people do, some people don't. I've seen both.
Yeah, but if I manage the health and safety myself, we can, I think the operators can study these and put a plan together. Do they have to have professional experience or professional designation of any sort, or just good business sense and ability to kind of develop, manage, and articulate a process?
You don't have to have a business designation or professional designation, I should say. You just have to have a commitment to it and just make sure, as I said, you're doing what you say you're going to do. A lot of times, the reason an IIPP is cited, it could be one of the elements. I mentioned the 9 elements. Missing one of the elements is a violation. Now,
Mm,
if you say you're going to, for instance, if you say you're going to do inspections once a month, and we talk to you and you say, well, we're only doing them every 6 months, you're not implementing your program. So you have to do what you say you're going to do. So someone needs to be someone needs to be in charge of that, and making sure that those things are being done. So as I said, we have the model program that you can set up on our
mhm.
website, and that's very helpful. And it actually has that new section as well that I was talking about, access. That's been in place since July of 2020, but we still see people don't have it. So just make sure that you go there, take a look. If you have an IPP, and like, as I said earlier, if it's older than July of 2020, you're probably missing that section. And if enforcement came, they could issue a citation for not having that particular section. So you just want to make sure, as I said, I can't emphasize enough how important it is to have that IIPP in place, and just have someone that's willing to commit to that and do it. It's a big job, health and safety.
Mhm.
It's not a small job.
Yeah, no, I certainly understand that. And, I don't know how, how the industry operators are, and, especially the new social equity participants are building these into their strategies and business plans. I know there's a lot of things that are overwhelming, and this is another one of those things you've got to tackle on behalf of your health and safety of your employees, right?
Exactly.
Is it something that I would imagine a lot of this, especially in the startup space, or the startup phase, just given limited resources, that probably people put these together themselves initially. Maybe as you grow and scale, you might engage professional help and assistance and consultants, et cetera. Is it fair that there's some resources like templates, or could you talk to your colleagues and you know obviously modify and customize the plan, but I have somewhere to start?
Well, we do. Like I said, we have the fillable program. So you just want to take a look and see what's going to fit your industry. I mean, prior to this, we didn't have fillable programs. It was a lot, I would say, more difficult to create one, to create an IIPP. These are and the state, there's, like I said, we have a state fund IIPP builder, which is really helpful. But I keep saying we have Cal OSHA consultation too. And when we go into a site, if I go to your work site, I'm going to take a look at your IIPP and tell you how it looks. I'm going to talk to your employees. I'm going to find out, how effective your IIPP is. Just, you want it, like I said, it doesn't have to be a book. I've seen very good IIPPs on less than 10 pages. So
Hmm,
it
yeah.
doesn't have to be, some people will pull out like a book that's several inches thick, which it doesn't have to be like that. It's just very basic. Just make sure the 9 elements are there, and that your employees know what those are. And if they want to see the IPP with this new section on access, they should be able to see it. Talk to your employees about your IPP when you set it up, because you have to have a section on compliance, that your employees have to follow your rules.
Mhm.
Because sometimes not following them can create a really serious hazard for people. And that's the reason you have people following your safety rules, and employees should know what those are. I've seen
Mhm.
some that have several levels, of compliance. It depends on the operation too. So the employer is going to just decide what they're going to do in terms of that.
Yeah. Well, that's good to know. I kept visualizing this, 3-inch binder, right? But yeah, exactly. So
Yeah,
that's
no,
good to
you don't
know. I
have to
think
have Mhm.
that's good advice. So speaking of the consultations, so I think that's an amazing offering or service offering. Can the consultation, can you come in before my business is running and before I hire employees, or is that too early to engage Cal OSHA?
In terms of coming to your site, it's much better if you have at least an employee there because we want to talk to your employees as well. It's part of our consultation process. But before you actually start, you can always call us and ask us any question you want. People call us all the time and ask us all kinds of questions. You don't even have to tell us who you are. They call us anonymously. We don't ask who you are. We don't ask which business you are. We just answer your question. So yes, you can call us anytime, even before you have employees.
Great. That's great. That's great.
Yeah.
So it sounds like Cal OSHA, they're there to assist. They're not just there to inspect and enforce, right?
No, I mean, I've been on both. I've been in enforcement and I've been in
Yeah.
consultation. And of course, in enforcement, as I said, very reactive. Most of the time I was going because there was an accident, there was a complaint. And consultation is the nice thing is that you invite us. So you know
Yeah.
when we're coming in enforcement, you don't know when we're going to show up. We just show up because
Yeah.
we're supposed to. But in consultation, you'll make an appointment with us. We'll come at the time that you ask us to come. We'll go through your programs. We'll look through your facility and tell you what needs to be fixed, and talk to your employees. So it's very proactive, and I always say it's good for you as an employer to say, we're being proactive. We want to make sure you're safe. That's why we're having consultation come out to help us with that.
Yep. That's great. Thank you. Thank you, Zara. Here's a question that came in from someone in the cultivation space. So it says, I'm a cultivator and not in retail. Do I also have to follow all the regulations?
Yes, you do. You still have to follow all the regulations. As a cultivator, though, I'm assuming you might be in an agricultural field. So if that's the case, now there are other regulations that might apply in an agricultural field. As I was mentioning earlier, the heat illness prevention plan that you have to have in place, you definitely need to have that in place if you're out in a field. There's a new section of our standard called nighttime work in agriculture, because some people do work at night now. And so if you're doing that, you have to meet certain requirements, such as illumination requirements, certain PPE that you have to be wearing, like safety vests. So yes, but yes, everybody still has to follow our regulations. It's just some may apply to you and some may not.
Great. Okay. Another question, it's a lead or a follow on to the consultation. If Cal OSHA consultation comes to the business and they find violations, do I have to fix everything they find? That's an interesting question, right? But
yeah. Well, part of the process of consultation is that before we come out there, you're going to be assigned a consultant by the manager of the office. They will talk to you about what's involved in a consultation. And we actually have a fact sheet on our page too, explaining what to expect with a consultation. But what we do is we come out to your work site. As I said, we'll set up an appointment with you, come out to your work site, take a look at your programs. If we find anything that we call a serious violation, and serious basically is the type of injury that could occur, like for instance, an amputation, serious injury where you could end up in the hospital, death, for instance. Those kinds of violations you have to correct and send us notification that you've corrected them within a certain time. If you need longer, we always have ways to, work with you and extend the time period. We'll tell you you're either going to have a regulatory, a general, or a serious violation. Serious ones have to be corrected and we have to be notified that they're corrected. But as I said, we can work with you if you need a longer period of time to correct them.
Yeah. Yeah, I mean, I'm sure it's a mutual kind of agreement, but I mean, I don't know what the next steps are if someone delays or doesn't meet kind of fix the punch list, so to speak, what happens next, right?
Well, if you do not fix a serious violation, that you don't do that, because there is a possibility that you could be referred to enforcement, and that is extremely rare. I think I've only heard of that happening maybe one time. And that's because employers, generally speaking, when they call us, they want to work with us and they want to make it safe for their employees. I can't imagine why you would leave something not corrected that could really cause a serious injury to an employee. So it's very rare. It can happen that you could be referred to enforcement for not correcting, but like I said, we try to work with employers. If they need a longer period of time, we can work with you on that. We've done that lots of times in our offices and do that a lot still.
Okay. Yeah. And that, there was a similar question, and it was kind of like, kind of like we all know it in trying a driving incident, a fix-it ticket, right? You get a fix-it ticket, so you get, time and resources to fix something or repair something, or right.
Well, yeah, people ask that of enforcement a lot. That would be more of an enforcement question, like, can we fix it before you issue a fine?
Yeah.
They don't do that. They basically, when they see it at that time, it's a violation, and that's a fine at the time they see it. Now, you're not given time to fix it before there's a penalty. But like I said, with consultation, even with a serious violation, there's no penalty. We just want you to fix it, so that, to keep the bottom line for Cal OSHA, whether it's consultation or enforcement, is to keep people safe.
Yeah.
Your employees safe. And, but yeah, there are no fix-it tickets.
Yeah. Good. And then a final question, just to kind of wrap up, and you kind of covered some of this, but when Cal OSHA consultation comes to my workplace and have done an evaluation, what is the process after that?
So after a consultation, you're done and the consultant's finished doing a walk around, looking at everything, going through everything with you, talking to your employees, because that's what they have to do to complete their visit. They are going to give you a report. A report will list all the findings that they found. They will list whether they're serious, general, or regulatory as well. They will tell you what the violation is, and and what you need to do. And they'll talk to you while they're on the consultation to tell you what you need to do to fix it. And once you get there, one of the things I like to tell employees, that's a confidential report that you're given. So you do not have to share that with anyone, including enforcement. I have heard of some cases, employers, they do a consultation with us and think they should give it to enforcement. You don't have to. It's totally confidential. And like I said, it's a free service. You can call us, ask us to come out. I hope that you'll ask us to come out, because that's where I think we were really effective, when we were actually on your work site. We can answer questions on the phone. It's very difficult to answer a hypothetical question on the phone. That's not really effective. It's really better if we actually see it. And so, hopefully you'll do that. Like I said, we can answer any question you want on the phone, but hypotheticals, we tend not to. And also, the other thing I was going to say is, pictures are not good either, because a photograph, I can't really tell anything. I don't see the 360 degrees around it. And that's what I really need to see if if I really am going to give you a good consultation.
Yeah.
So definitely.
Well, that's great information. And I guess, what was kind of cleared for me is, the consulting team is not the enforcement team. So they're there to help and resolve and prevent. And then when enforcement comes, they're there to fine you if they find major violations. So I think that's great that Cal OSHA has built that kind of a resource and structure to help. All right.
It definitely helps. And I'm really hoping that everybody will call us to come out to your work site and take a look. We have some really, really good consultants in all of the offices. Some of them have more experience than I do. Like, there's some with more than 30 years experience in the field. So you've got some really, really experienced people that know their stuff.
Yeah. Well, great. Well, Zora, thank you very much. I mean, it's it's, Cal OSHA, I mean, all businesses, we all have to understand it, apply and work with Cal OSHA like we do with other city and state departments. But in this new industry, in this new space, it's great to get information, education on who to access and how to get help and assistance. And I think it's valuable that Cal OSHA provides that, and we look forward to that. I want to thank everyone for attending today's webinar offered by the City of Los Angeles Department of Cannabis Regulation. The webinar recording will be found on DCR's website at cannabis.lacity.org. I also know that Zora had put together a great resource page that will be posted and distributed as well, and that will be kind of a quick resource links to sites and websites and web pages that will assist you in your business. This webinar, it will take a while, for editing and revisions, but it will be found on DCR's website at cannabis.lacity.org. If you have any questions on accessing your account, please email dcr.sep@lacity.org. Also, please plan and join us on our next webinar, which is this Thursday evening at 6 p.m., where we will discuss the state of California requirements from the California Department of Tax and Fee Administration. You will all want to get this information as it relates to tax collection and understanding the taxes. Also, a reminder to please join the December 3rd Unite Networking Mixer at the historic Mayfair Hotel, hosted by the DCR Social Equity Organization. This event is for the social equity community and social equity individual applicants. Come out and meet operators and innovators and see the resources, tools, and support services provided by the social equity program. I want to thank everyone again tonight. Thank you for joining us. Have a wonderful evening, and we will see you on Thursday night. Thank you. Good night.